Now stay tuned for an all-new Dateline, followed by a special Monday Law & Order and an all-new Third Watch, NBC Tonight.
This is Dateline Monday, November 6th, 2000.
Good evening, I'm Vi.
And I'm Kadin. Welcome to Dateline. Tonight, our top story features a physician assistant class at Barry University that has been exposed to anthrax. It seems as though their microbiology professor may have been the cause, having accidentally dropped a vial of this deadly agent.
But first, we will show the story of an infant that survived an unusual illness, her trifling journey to wellness and recovery. We will begin by going to the scene of her home in central Louisiana, where her family lives. Reporting from NBC News, this is Vi. Russ, are you there?
Yes, Vi, this is Russ. I'm here on scene. It seems as though the past medical history was not significant and all her immunizations were up to date. Julia lived here, in this house in southern Louisiana, where outdoor exposure was frequent. Julia attended a daycare center at which there had not been any reports of unusual illness. There was, though, a kitten in the household that had scratched Julia 1 month earlier. Alright, good. Julia's parents had observed bats in their yard, in the wooded area near their home, but they denied any unusual exposure to mosquitoes and other insects. There was also no recent travel history. This is Russ reporting live. Back to you, Vi.
Thanks, Russ.
Julia was brought to her family doctor with a persistent fever of 102 degrees Fahrenheit. The doctor prescribed oral cefprozil and sent her home. Seeing no improvement in condition, Julia was then transferred to a hospital in New Orleans for further evaluation.
We now have Bart live on scene with Dr. Hansela, who's going to explain to us the physical exam and lab findings of Julia while she was being evaluated in the hospital.
Thank you, Vi. This is Bart Nell. I'm here at the hospital with Dr. Hansela, who just wrote up Julia's report. Dr. Hansela, could you read the physical exam findings from the confidential report that you just wrote up?
Sure, Bart. The vital signs upon physical examination were as follows. Rectal temperature of 38 degrees Celsius, pulse of 172 beats per minute, respiratory rate of 40 breaths per minute, blood pressure of 100 over 34, and an oxygen saturation of 99% on room air. The infant seemed to be well nourished, and she presented as lethargic with poor head control. She appeared acutely ill, her pharynx was reddened, and she had some vesicles on her lower lip. Upon neurological examination, she showed uncoordinated movements, drooling, right hemiparesis, right central 7th cranial nerve paralysis, bilateral astropia, bilateral extensor plantar responses, and increased reflexes on the right side. She also had a scattered papuloerythematous rash on her abdomen and lower extremities.
I see, very good. All right, this is Bart from the hospital live, only at Dateline.
Bart's currently on the way to the lab
to continue with his interview.
Hi, this is Bart again. I'm here at the laboratory now with the Superior Laboratory Specialist Supervisor, who has the confidential laboratory findings of Julia's case. We understand that a spinal tap and blood profile was done. How can you tell us about it?
Well, upon her admittance to the hospital, the patient underwent a spinal tap. Analysis of the cerebrospinal fluid showed the following. The presence of white blood cells, patient's value here in red and normal in black, indicated an infectious process was occurring. The presence of segmented granulocytes, or more specifically polymorphonuclear leukocytes, indicates either a bacterial infection or an early viral infection was occurring. In addition to the spinal tap, a blood profile was requested. The results were as follows. Serum electrolytes, glucose, and creatine levels were within normal limits. The high white blood cell count again indicated an infection. And the increased number of segmented cells was suggestive of a bacterial etiology.
What other tests were done?
Well, Bart, an ECG, chest x-ray, urine analysis, and CT scan were all performed, and they were normal. An EEG indicated bilateral cerebral dysfunction, but there was no localization, and furthermore, no seizure patterns were seen. The results, such as these, are suggestive of an encephalopathy.
Okay, how about an MRI?
Very good question, Bart. The cranial MRI showed abnormal increased high density signals on the T2 weighted images involving white matter. It is a non-specific finding and can be suggestive of an inflammatory or an infectious process.
Okay, this is Bart live with Dateline. Back to Kadeen, I forget your name, Kadeen, at the station.
Oh, good work, Bart. It looks like the physical findings suggest an extensive differential diagnosis.
Luckily, a couple of the top medical universities in the country are working together in conjunction to put these pieces together. Barry University
And Harvard University.
are working hand in hand around the clock to solve this case.
We will now bring you some amazing footage at these teaching colleges with Dr. Minella during the grand rounds.
Remember, this is exclusively brought to you by Dateline.
Hello, medical students at Barry University and Harvard. Thank you all for coming and taking your time out of your busy schedules. In this case, the MRI findings have strong evidence to suggest diffuse meningoencephalitis as the responsible disease. The differential diagnosis of the causal agent was quite extensive, and many tests were done to narrow out the possibilities. The herpes simplex virus was indicative of vesicles in her mouth along with the rash on her lower extremities, but was not consistent with the MRI that showed a diffuse pattern. The herpes characteristically involved only temporal lobes. Other enteroviruses can also cause rashes and vesicle eruptions, such as the Coxsackie virus A and B. Enteroviral diseases usually occur as annual epidemics, and there were no similar cases in the daycare center she frequently went to. Arboviruses were also considered. Oh, is there a question in the back there? Yes, you in the back.
Yeah, what is an arthrovirus?
Okay, an arbovirus, that's what you mean. It's a virus that is transmitted by an arthropod.
What is your name?
My name's Mark.
Good job, Mark. Good question. You get a point for that.
Well, HIV infection was considered, but thought unlikely because of the patient's low risk factors. Another neurotropic virus that produces encephalitis types symptoms is rabies. Although the parents did mention seeing bats near their home, it is difficult to pinpoint exposure to animals which may contract rabies since the incubation period is so long. Some more treatable causal agents were lower on the differential diagnosis list. Borrelia burgdorferi, like it says here. That was responsible for Lyme disease, but unlikely because of the lack of travel history. Bartonella hensella, that sounds familiar. That's the cat scratch disease, was a candidate, but because the patient was scratched by a cat 1 month previous to the manifestation of symptoms, so we kind of consider that one. Then we also considered TB and syphilis, so we did screen tests and skin tests were performed.
Wow, that was some fascinating footage.
It sure was, Vi. Now we are going to join Russ, who is live at New Orleans Hospital, interviewing Dr. Hensele, who made the definitive diagnosis.
Again, recording live exclusively on Dateline. This is Vi. Russ, are you there?
Okay, Vi, I'm in a little traffic over here. I'm on my way over to see Dr. Hensele. Son of a bit! I'm now here at the hospital where I'm going to meet with Dr. Hensele. Here we should find out the definitive diagnosis of Julia. Oh, here's Dr. Hansella's room right here. Hey, doctor, how you doing?
Hey, come on in, have a seat.
I know you're real busy, so let's get started right away. What'd you determine to be the final diagnosis?
The final diagnosis was acute disseminated encephalomyelitis. The specific causal agent, however, was not definitively determined.
Okay, can you tell me what exactly the disease is and some of its characteristics?
Sure. Acute disseminated encephalomyelitis is a demyelinating disease that typically affects the white matter of the central nervous system, spinal cord, and optic nerve. It is an immunologically mediated inflammatory disease that is characterized by perivascular CNS demyelination. It can occur spontaneously, but it usually follows a viral infection or a vaccination such as smallpox or rabies. Initial symptoms include nuchal rigidity, headache, sensorial depression, fever, and a myelopathic pattern. Sometimes drowsiness and seizures are seen in children.
I see. I know in Julia's case, the precise agent was not determined. Can you tell me some causes that might have led to her state?
Sure. There are several possible causes of the CNS demyelination that Julia experienced. The precise molecular mechanisms are unknown. However, models suggest that both an infectious mechanism and a secondary autoimmune response contribute to the CNS demyelination. Pathogens associated with acute disseminated encephalomyelitis are predominantly enteroviruses. However, some different etiological agents have been reported. These agents include viral and bacterial organisms such as Mycoplasma pneumoniae, Bartonella henselae, Legionella cincinnatus, Group A Streptococcus, Chlamydia trachomatis, Rubella virus, Varicella zoster virus, Herpes simplex virus, human herpes virus 6, and Epstein-Barr virus.
Wow. Okay, I know that the differential diagnosis is extensive. How'd you reach the final diagnosis?
Well, the most definitive test for diagnosis of acute disseminated encephalomyelitis is an MRI. A positive film is one that shows multiple symmetric patchy areas of increased signal intensity on conventional T2 weighted and proton density weighted images, mostly seen in the subcortical white matter. I know a couple of other things that are important enough to mention. The severity of acute disseminated encephalomyelitis is variable, ranging from mild to severe. Recovery time is also variable, and it is expected that more than 50% of the patients will completely recover. Mortality rates depend on the etiological agent and have been reported as high as 30%. For example, measles-associated acute disseminated encephalomyelitis has a worse prognosis than vaccine-associated acute disseminated encephalomyelitis.
Thank you, doctor. That was very informative. Now back to you, Vi. This is Russ.
Wow, Russ, that was great.
Finally, we are going to join Vi for an interview with Julia's parents. There we will learn about Julia's treatment and outcome of this devastating journey.
Where is she? She's supposed to be here. We're supposed to be on TV. Oh, here she comes. Watch out for that phone book. I was supposed to pick up that phone book before.
That's all right, that's all right. This is Vi. I'm here live with Julia and her parents. I'm sorry, I forgot your name.
My name's Norm, and this is my beautiful wife, Flora. They call us Normal Flora. That's what they told us to say.
Could you tell us a little bit about Julia's course of treatment?
Sure, you can see she's beautiful sitting there right now, you know. She's doing okay because of the treatment. But at the hospital, before the hospital, they put her on antibiotics, they call, and they put her on cefprozil, it's called. Then when you got to the hospital, they put her on more antibiotic. And when they have an IV, they call it. So it goes right into her blood. Just like this pill here, goes right into my blood. But anyways, that's called ceftriaxone or something like that, and vancomycin. They gave her for antibiotic. And then she got no improvement. She was doing about the same, so they gave her more antibiotic. Yeah. And they call that one like Cloville. I forgot what the name is, but those damn antibiotics don't work, right? No. So they did something like an MRI or something with the brain. I don't know. Then they gave her prednisone. I got those word right. And she got an allergic reaction, so they gave her some stuff that would give her, what do they call that? Benadryl. Then they gave her more of that methylprednisone. I don't know why. But then they finally gave her an immunoglobulin. Those immunoglobulins work very well, right?
Yeah.
And as you can see, after the immunoglobulin, she's a lot better now. I think it has to do a lot with Halloween. Those globulins, you know, they scare a lot of things away. So I think that's what it's all about, right? Look at her, honey. She's beautiful.
And that she is, Norm. Well, thank you, Norm and Flora. It was a pleasure meeting you and your beautiful daughter, Julia. From all of us at Dateline, we wish you and your family the best.
Thank you.
Excuse me. As we have seen here tonight, a definitive diagnosis in medicine is not always easy. With the help of Barry University
And Harvard University.
the correct diagnosis was made, and Julia had a full recovery.
After the commercial break, we will continue tonight's Dateline with an update of the anthrax catastrophe.